Have you ever really stopped to think about the incredible hidden networks that power our simplest daily actions? Inside all of us, there's this complex wiring system that turns a simple thought into a physical movement. And today, we're going to trace one of the most important cables in that entire system. Just think about it for a second. Waving, giving a high five, or just gesturing. All these things feel totally effortless, right? Almost automatic. But what's actually making your arm, your wrists, and your fingers extend in just the right way to do all that?
Yep, that's it. The hero of our story today is this one nerve. It is the master controller for so much of what we think of as just basic arm and hand movement. So let's follow its path and figure out what makes it so incredibly important.
Okay, so if the radial nerve had one main superpower, what would it be? Well, in a word, extension. You can think of it as the great extender of your entire arm. And extension is really just the act of straightening a joint. Seriously, go ahead and try it with me right now. Straighten your arm all the way out. Now, lift your wrist back, like you're telling someone to stop. And finally, open up your fingers, spread them wide. Every single one of those movements, that's all being powered by muscles controlled by the radial nerve. So to really understand how this nerve does its job, and maybe more importantly, how it can get into trouble, we need to follow its journey. Let's trace this thing right from the beginning all the way down to your hand. The journey kicks off way up in your armpit, inside this incredibly complex web of nerves called the brachial plexus. The best way to think of this is like a major electrical junction box for your whole arm. And the radial nerve? It's one of the main cables coming out of the back part of this box. And this is where it gets really interesting. The nerve doesn't just go in a straight line. No, it takes this sharp, dramatic turn and it winds tightly around the humerus. That's the main bone in your upper arm. This specific path is called the spiral groove. And the fact that it's so close to the bone, well, that's absolutely critical. We're going to see why in just a bit. So after it makes that trip around the humerus, the nerve just continues its journey down the forearm. It starts branching out to all the muscles it needs to power, and eventually it reaches the skin on the back of your hand. And just like that, its journey from your shoulder to your fingertips is complete. So like a lot of major nerves, the radial nerve is a bit of a multitasker. It kind of wears two hats. It has a motor function that's controlling movement, and it has a sensory function, which provides feeling. Let's break those two down. Think of it like this. On one hand, it's sending signals out from your brain to your muscles, telling them, hey, contract. That's the motor control part. But at the same time, it's sending signals back to your brain from your skin, telling you what you're feeling. That's sensation. Okay, on the motor side, let's think about three key actions. First, it powers your triceps muscle, which lets you straighten your elbow. Bam! Next, it powers the muscles that lift your wrist up. And finally, it controls all the little extensor muscles that open your hand and straighten out your fingers. And here's the key takeaway. Without the radial nerve, you just can't open your hand properly. Simple as that. And here, we can see its sensory job illustrated perfectly. The radial nerve is what gives you feeling on the back of your arm and forearm. And see that shaded area on the hand? It's also responsible for the sensation on the back of your thumb, your index finger, and your middle finger. Pretty specific, right? All right, so we've seen its path. We know its jobs. But that winding path we talked about, especially where it hugs the bone, well, that makes it vulnerable. So let's take a look at what happens when this master controller gets damaged. What's so fascinating is how the symptoms of an injury depend completely on where it happens along the path. If the injury's way up high in the armpit, maybe from leaning on crutches wrong, you can lose control of everything, your elbow, wrist, and fingers. But if the injury happens lower down, at that spiral groove we mentioned, say from a broken arm bone, your elbow might work just fine, but you'd lose control of your wrist and fingers. It's like the damage creates a perfect map, showing us exactly which part of the nerve's territory has been cut off from power. And all of this brings us to the most classic, the most telltale sign of a radial nerve injury, something called wrist drop. And it's exactly what it sounds like. The muscles that lift the wrist are basically offline, so the hand just hangs there, completely limp, unable to fight gravity. And here's a common, almost famous real-world example. It's often called Saturday night palsy. And this can happen when someone, maybe after having a few too many drinks, falls asleep with their arm draped over the back of a hard chair. They're compressing that nerve in their armpit all night long. They wake up in the morning, and boom, they can't straighten their wrist or fingers. It's a direct result of that high-level nerve compression.
Now, here's a final, super crucial point that might actually surprise you. You might think this nerve is all about opening the hand, but it's also absolutely essential for making a powerful grip. To make a really strong fist, you need to hold your wrist straight or even slightly extended. Go ahead and try it. Make a fist with your wrist bent all the way down. Now do it again with your wrist held straight. You can feel how much stronger that straight wrist grip is, right? Well, that stability, that's provided by the radial nerve. So it's not just for letting go, it's for holding on tight.
It's pretty incredible, isn't it? A single, fragile nerve that orchestrates so much of how we interact with the world. It really shows how our bodies are this amazing mix of being both powerful and incredibly delicate. It kind of leaves you wondering, what other simple daily habits, like how we sleep or how we lean on a chair, might be putting these critical pathways at risk without us even having a clue.